Hey, welcome everybody. This is Euronurse on StreamYard today instead of our usual Zoom forecast or programming. Um, Welcome. We meet every Saturday at 9 a.m. Central Time. And if you're watching this on YouTube, great. Be sure to hit that like button and that subscribe button. And for the first time, we're going to also be streaming live on FaceTime. So if you're watching us on FaceTime, you can go ahead and hit that like button. If this is your first time watching Euronurse, be sure to check out our website at euronurse.com. That's where you can find out more about how you can become a part of the show. It's also the very best place to go if you want to find out about previous episodes and watch our episodes. They're all available on demand anytime you want to watch them. And they're all available on our website at euronurse.com. And talk about episodes. We've got 31 episodes in the bank already. Today is our 32nd episode. So we've been going strong. And we'd like to thank our sponsors for helping to sponsor this program. If you're interested in information on that, do click that sponsor info button to learn more about how you can become a sponsor. For those of you that are new to this, well, all of us are new to StreamYard. It's a little different. It's instead of being called a Q&A box, it's called a comments box. So just enter things into the comment box. There is a private chat box. Well, at least there is one on mine, so that you wouldn't use. So just the comment box. This week, I'm going to be talking about artificial intelligence, what it is, what we can do with it. I'm really having a lot of fun with it, and I'm going to show you some of these programs that I've been using and how to use them. So let's bring in our panelists here, our great group of three that are with us today. And let's see here. I'm just going to put our names back up here. So for those of you that are new to the program and don't know who we are, my name is Vic Senese, and I'm the producer and program host for this show. I've been in urology for about 30-some years, so lots of experience. Andrea, let's bring you into the picture here. Give us a little introduction.
Hi, my name's Andrea Strong. I'm a urology nurse practitioner in Wisconsin. I've been working in urology since 2010. Many of those years I spent as a nurse. I worked inpatient, I worked outpatient, and I'm currently certified as a urology registered nurse, and I look forward to talking with you all today. Thank you.
Great. And John, go ahead and let us know who you are.
Hello, everyone. I'm a private practice urologist in Gilbert, Arizona, who wants to pay it forward like what Vic is doing by sharing my experience in the business of medicine to benefit my colleagues. I'm the admin of the Thriving Urology Practice Facebook group, where over 2,100 US-based urology practice personnel collaborate to improve our practices, and that is all for free. I look forward to our collaboration today.
Yeah, and I think that's the key. We bring all this to you free, and it's thankfully we've had some sponsorship, which really helps. So that's always great, but free to you guys. So enjoy it. Oops, I knew I would hit the wrong button eventually. So now we can go to favorite stories, and I'm going to kick off with a technology story. And I'm new to Medicare, and I get a phone call, and you know how we get these robocalls. Well, I get this telephone call, and it's, hey, this is Medicare. We'd like to ask you a few questions about your coverage. And it's a very normal sounding voice. Sounds like a real person to me, fooled me. And they start off with a question. So do you currently have coverage through Medicare? Well, of course, what are you going to say? Yes or no, right? So you say yes or no. And then they go, oh, great. Just like a conversation, like you'd expect. Well, finally, I kind of thought, I don't think this is a real person. So then it said, would you like to learn more about Medicare? I said, what's your name? No response. We can answer any of your questions that you have about Medicare. Just let us know what you want to know. And again, very conversational tones. I said, how's your weather out there? I said, forget it. I know you're a robo-caller, and hung up on them. So that's my favorite story, how to get rid of those pesky callers. But they're willing to fool you if they can. I didn't ask John or Andrea. Do you have a favorite story to share with us today?
Andrea, go ahead.
I guess I have a story. It's not as entertaining as other stories, but recently I've been working trying to improve my efficiency as a nurse practitioner. We've got a lot of demands in the workplace, telephone calls, seeing patients, refills, paperwork. And I've been taking some courses with Epic. And basically what they're saying is that the fewer times you have to click with your mouse, the faster you can move, which at first I thought that sounded silly to me. But I did the education and I found different ways to reduce the number of clicks that I'm doing through smart phrases and smart text and just auto populating things. And I have been able to reduce my charting time by 1 minute per note. And that really adds up.
Nice.
If you're seeing 20 to 30 minutes or 20 to 30 patients a day, that's 20 to 30 minutes. And I think there's still some room for improvement where I could maybe make things a little faster. So I'm very happy about that.
That's great.
Yeah. John, do you have a favorite story?
I always have a ton of favorite stories. All right. So I see a lot of vasectomy patients. I do a ton of vasectomies. And I'm looking forward to our upcoming talk on March 25th. Yeah, March 25th on Euronurse about vasectomy. So this is one of these vasectomy patients. Recently, I got a couple of bad reviews because not only to address the issue at hand, the undesired fertility, but if the patient is overweight, if the patient's obese, if they're morbidly obese, if they have uncontrolled hypertension, I will talk to them about these issues. The 2 recent negative reviews came from patients who are morbidly obese, and I discuss the things the potential bad outcomes that can occur, including some urologic issues, and also obstructive sleep apnea, the urinary frequency, the nocturia, the erectile dysfunction, the increased risk of kidney stones. So I address those issues, as well as, do you want me to refer you to someone who works in bariatric medicine? If you can't do it by yourself, maybe someone in bariatric medicine will help. Well, I thought everything went great with this patient who was morbidly obese, body mass index over 41. I mean, this guy was a big guy. And they're just huge risk factors for this guy to just have a stroke, heart attack, hypertension, hypercholesterolemia, all sorts of things. I thought everything went great. Everything was beautiful. But then he left this review. And also he mentioned something about the way my awesome front desk person, Milana, she was just the sweetest lady, sweetest woman, young woman. And this is his comment. He said, did not appreciate the pet names receptionists used. I am not her hun and don't find it cute. So, this is how it starts.
Yep.
It's a professional office and should be treated as such. I can't tell you. I mean, we are extremely, extremely professional. On Google, we have close to 1,000 Google reviews. Anyway, and he says, Dr. Lee, patient interaction is impersonable and lacks care that you would hope a physician had in helping you reach your health goals. So anytime I get one of these reviews, I always think, okay, well, was there something I could have done differently to do better? But I remember this gentleman very well, and I know I did nothing unusual. Maybe he was just having a bad day. So always, when you look at these reviews, always take a step back and say, was there something that you did wrong? Can you do better? And then try to address any deficiencies that you may have in your practice. Or could this person just be unhappy because I brought something up that he didn't want to address? That could be the case as well. But anyway, that's my story. I have tons of stories. We had a EHR upgrade this past week, and yeah, tons of stories. But anyway, I'll stick to one.
Yeah, I think that's a great story because we get the same thing. You'll get a lot of complimentary feedback, but what sticks out is that one person who had a bad day or a bad experience, and you just never know what's going to happen, and that's the one that they, of course, nail you with, right? So, well, great. I'm going to kick it over to let's see here. So we're going to get rolling on our show on artificial intelligence, what we can and what we cannot do with it, or how we're going to use it. So I think that's the really important part. So I like to start off with just a definition. What is machine learning or artificial intelligence? And it's the ability for a machine basically to kind of do the things that normally would require human intelligence, reasoning, problem solving, decision making, those type of things. And that's what they kind of go along as the definition. All the biggies are getting involved in it: Apple, Microsoft, Meta, which is Facebook, Amazon, Google. And most of these companies have been doing this research for over a decade now. But just now, I think we're starting to see where this is coming into the mainstream, where it's actually being utilized. So the question I always say is, how is a machine able to think like a human being? Is it really thinking? Is there some magic going on here? And at the bottom, it's machines do what machines do. They operate on algorithms and statistical models. They recognize patterns and they make predictions based on the data that they have. Well, they have a lot of data because they've got an internet's worth of it. So that's how they trick us into thinking that they're really thinking. The two I'm going to talk to you about today have had a lot of press, and I've been using them. ChatGPT, which is by a company called OpenAI, and the other one is MidJourney. MidJourney is for those of us that have ever wanted to become an artist and don't draw, you can't draw like myself. This is the way that you can become an artist. So what does ChatGPT stand for? Well, it's Conversational Generative Pre-trained Transformer. Boy, that's a mouthful that tells me nothing. So I think that the better definition is it's basically a program that can talk to you in natural language, just more humanized. And I think really the best example is to just show you how the program works. So I love bread, and I have a bread machine. That's my favorite toy. So I like to make bread throughout especially the wintertime months. Nothing better than a smell of a loaf of bread cooking. But anyway, I bought some corned beef. You know, we're getting close to St. Patty's Day, and I decided we're going to have corned beef and cabbage. I thought, boy, would some Irish soda bread go really good, but I don't have a recipe for that. So what do? You go to Google, right? You go and Google it. Give me a recipe for Irish soda bread. And that's what I did. And I got the typical what you see Google give you, you know, a bunch of websites that are recipe websites that have probably really good recipes. But now I've got to go to that website, look it up and do it. So let's see what happens if I ask ChatGPT to do the same thing. So I go to ChatGPT and I ask it for a recipe. This is real time is what it's, and again, look at the natural language. Here's a recipe for Irish soda bread. It can be made in a bread machine. Gives me a list of the ingredients. I don't have to go and write a list. I can copy and paste that into my phone for going to get the recipes or the ingredients at the store. Here's the instructions on how to cook it. Again, very natural language. It doesn't make spelling errors. It doesn't speak, you know, in wrong tenses of the verbs. Tells me what temperature to cook it at. And this is my favorite part. Enjoy your freshly baked Irish soda bread. So it even has a little conversation with you. Now, something more to the heart of what we do. We've been talking about clogged Foley catheters, so go to Google. Let's see what Google will tell us. Now, I will point out up on the top there, you see there's a little passage. Google's also working, as I said, they're all coming up with their own AI, and Google has its own AI called BERT. And so some of this, before you even see the list of things that, you know, we typically get that list of websites to visit, it does give you a little description. So we're going to start seeing more of this incorporated, I think, in search engines. And I'll talk a little more about what Microsoft's doing. But anyway, you know, the typical, you would search for this on your website. Then you'd go and you'd read the research and look at it and pick the best research you want. And that's kind of where you start. But how would ChatGPT do with this? So again, same thing, causes of clogged Foley catheters. And here, I'm going to let this run through here, but you can see very normal, comfortable language. If you were writing a paper on this, you could really, you know, cut and paste, and trust me, it's being done. It's probably one of the drawbacks, but I like how it's breaking it down in incrustation, blood clots. Now, one caveat is we're all in urology, so we kind of know this subject matter, so we know if something's really way off base. But if you're, somebody who has no medical training at all, and you were to look this up because you were worried about your own clogged Foley, you don't know if this is accurate information or not. And that can be one of the risks, is having information that's not really accurate. I've read some stories online about people arguing with the AI, coming back and saying, this is not correct. And the AI will come back and say, I've done a search and you're correct. That wasn't right. So that's how they learn. So it's kind of interesting. Here's something I think that Andrea might find useful, because she's our director of education. So if you got to submit for CEs and you need to get an outline on something, let ChatGPT do the work. So I want an outline on that presentation for catheter blockage. So you see it comes up with the introduction, breaks it out into bullet points, causes of catheter blockage. And again, this is not being sped up. This is actual live time. So you really can get a nice description of what you're talking on. I love making slides. I love doing presentations. I hate doing the paperwork. So having this to help me is great, because I'm way ahead. And if I'm building a slide package, having this outline, I can go in and start grabbing pictures from this off of what I want to build to do my talk. I mean, I think I could really come up with a great talk on catheter blockage built right off of this outline. And all this stuff is copy, paste, tweak it however you want. So you can do with it what you want, which is what's really nice. But talk about time saving. People are using it to write letters to insurance companies when there's denial of coverage. And, it's got to at least be a good starting point, if not the whole letter. So there's a lot of places that I think we're going to see ChatGPT take off. So there's at the end of that one. So nice thing about, we were talking earlier about, if it's free, it's got to be great, right? Well, we all like free, don't we? So ChatGPT is free. There is a website. You just go to chat.openai.com, sign up. It's maybe getting a longer waiting list to get on, but it was pretty short for me. They want people to use it. And the reason for that is because the more people out there using it, the better it's going to get. Now, OpenAI quoted that it costs them about $100,000 a day to keep up the servers. That's to maintain the system going. So there's some cost involved in this. So for a free service, that's pretty good that they are giving that out. Again, they do offer a $20 a month program. And the reason for that is you can get what they call their ChatGPT Plus. And the issue is, if you've used it and you're doing it during peak times, you may not even get on, because the busier it is, the less likely you are to get yourself onto the server. So it may say busy right now. Well, if you pay the $20 a month, you're going to get on immediately. It's going to put you through as a priority customer. So there's some benefits. It also probably says it's going to be faster. But I can tell you, the reality is I've had very few issues with it getting on it, and timing, having to wait. I've had some, but not enough to pay $20. I can tell you that. But don't feel too bad for AI. They just got $10 billion. That's what $1 billion from Microsoft. And the reason they invested in them is they want that technology for their search engine, Bing. Now, if Bing is just like a little tiny minuscule part of the search engine world compared to Google, but they want to be bigger. And so you can go to Bing right now, and they have introducing new Bing, which is the ChatGPT powered Bing. And you can get on their wait list because, again, it's being rolled out. But I signed up for that one. It took about, I think, a day, 24-hour period, and they sent me back, hey, welcome, you can use it now. So I was able to use it. The program works really well, and but it's not quite up to I would say the ChatGPT standard, as far as it's not quite as good, but it gives you some searching along with some answers. So it's only going to get better. Now, MidJourney, I mentioned that I'm not artistic at all, and but I do like to make pictures, and I like to draw. And if you look at the website, some of those are hand hand drawn by myself, just as fooling around, but they're not very good. But MidJourney makes us all an artist, and it's free. Well, kind of free. So MidJourney will give you 24 pictures that you can produce for free. After that, you need to get a subscription. I can tell you I have a subscription, but there's some benefits to having a subscription. These are the monthly rates. They do have a little bit off if you buy it by the year. I bought the basic package, which lets me make 200 per month. And it does have the other advantages. It gives you your own window on it. And you'll see that when I show the program, how it's harder if you use what they call the newbie windows. And this is the key thing that I really like to do is I like to use the artistry in websites, etc. And, in your presentations, your PowerPoints, if you just take a picture off of Google and utilize it, you're really probably you're not licensed to use that picture. If you pay for this and you use the picture that you produced, you can use it. It's yours. It's your license because you own it. And that's kind of one of the benefits that I found that's really nice is that I'm able to use this art and not have to worry about it. Now, I mean, if you're doing a PowerPoint presentation, is somebody going to, litigate you for using their picture? Probably not. Especially if you give them credit on the PowerPoint presentation. But if you're like, I build websites, you put it in a website and it's a very successful website and somebody says, hey, that's my picture. You could get litigated for that. So I try to make sure I'm very careful that I'm buying all my licenses whenever I use any artwork in my websites, but now I'm able to use these because it's part of what I have. So MidJourney, you have to join their beta. It's a beta program. And for those of you that are not into computers, it's going to take you into a world of hurt because it's not going to look like your normal, friendly, everyday computer. This is what I've already bought this program. So this is what my MidJourney looks like when I open it up. Not much there, but you need a second program for it to work. You need a Discord server. Now I just threw a word out that's going to be scary to most of you. Discord.com. It's a free service, totally free. Open in your browser. You can download the software, but you have to have it in order for it to work. Discord is a social server where people meet up and can do all sorts of things that you can do on a server, exchange files, etc., things like that. I'll tell you, I didn't use Discord till I got MidJourney, so I'm kind of new to it myself. But anyway, this is what it looks like. This is Discord running MidJourney, so if that makes sense. So I click on that little sailboat, it brings me into the MidJourney part. And everything that you build in MidJourney requires imagine prompt. Those are the big words to remember. If you want to do anything, put in your /. It'll give you a bunch of choices. Pick the imagine prompt. And then all you have to do is put a description in. So I want a robot dressed in surgical scrubs working over an operating table because I'm going to use that in something. And what it pops up is 4 pictures close to what it thinks you would have wanted. And you can say how you want it to look more comic-y, more realistic, lighting. You can add all these definitions in there. But this was a real basic one. And then what you do is you've got a choice. If it says, I missed everything, you can hit that circle and it'll give you 4 new ones. But if you like one of them, that's what the V1, 2, 3, 4 is. So I like number 2. That's pretty close to what I'm looking for. So I hit V2, and what it's going to do is it's going to produce 4 more pictures that are, now see, this was the free service. So I'm in a newbie room. So I got to hunt for my stuff to come up. When you pay the subscription, it's in your room so you can find it. So you can see now those all look pretty close to that first one, but a little variations. So now maybe one of those is exactly what I'm looking for. So I can go hit the U's, 1, 2, 3, 4. So number 4 I like. So U means upscale. So those are all low quality images. So when I hit the U, it's going to give me a full high quality image. And you can even dictate how high of a quality. You can say I want 4K or whatever. So again, I'm just doing some basic commands here. The best way to learn is to look at some of the stuff people have done, and it'll show they get their prompts. But here it is in upscale, so high definition. There's my robot doing surgery on an operating, some kind of table. So what do you do with this? So I as I was talking about, you take MidJourney and ChatGPT, put those two together, voila. I now have the artwork I need for my thumbnail, for all my different programs. For my website, I've got it, and I've got a description of the procedure that I'm going to have generated by ChatGPT. So how does it do it? Well, remember testosterone therapy? I asked it to, what's testosterone therapy? And it gave me this definition. Looked good to me. Then I went to MidJourney and I said, give me a picture of a muscle-bound man flexing. And so, boom, there's my muscle man flexing with my description. And I can tell you that I couldn't draw that guy for nothing. I would have to pay for the artwork or find, I've got some programs that I've paid in the past for it, utilize one of those, but being able to kind of exactly what I was looking for, that guy with the flex, that's really fun. That's one of the dangers too, because it is kind of fun. So you can start find yourself waddling away a lot of time on it. But it's not all good news. There are some dangers with AI, and I'm going to point those out too. Discrimination and bias. These programs are written by people. People have biases. And if they're right-wing or left-wing lying, some of the programs could show some of that. Now, we know already that there's been bias in facial recognition algorithms, which have higher error rates for people with darker skin tones. And what about when the automation becomes so ubiquitous with all industry that suddenly there's no jobs? A lot of these, I went to a meeting, and one of the things that they were talking about was a certain price point where they were going to start replacing people with machines for fast foods. And it was $15 an hour that they were saying that would be the point where they could start replacing. Well, guess where we're at? And they're doing it already. This is a robot called Flippy. I've heard that White Castles is buying a lot of these, and it takes over the whole operation of making burgers. And it can clean itself. It can clean the stove. It doesn't call in. It doesn't get sick. And hey, waiters and waitresses, you could be replaced too. They've got this going on where they preload your food, tell it what table to send it to, and off it goes with your drink and food and all your good stuff. I wonder if you have to leave a tip. And then the hotel industry is also getting involved in this. So this is the Sheraton. You'd normally get that rack to put your luggage in and push up to your room. Well, now they've got a robo rack. You go ahead and put your luggage right inside here. It's got a locking door. And then it's programmed to what room you're going to. So it'll know what room you're in. It'll lock. It'll come up to your room. It'll call your phone, let you know that, hey, I'm here. It'll give you the code to open it so nobody else can steal your suitcase and take it right up there for you. Another job gone. And then, of course, we know that computers have been hacked, and that's not AI systems at their heart are computers. So we have to be worried about, privacy issues and cyber attacks, etc. And, already we have drones that are flying with no pilots in them. But what happens when there's nobody, on the other end of the joystick except AI making the decisions on who to kill and who not to kill? And these are getting to be so complicated that even the programmers are not always sure how to fix them, because the systems are done by multiple people and they just don't, they get more complex. It's going to be harder to figure out what's running what. And this one, I think I kind of worry a bit with my grandkids is, the dependence on AI. As they get more and more dependent on using computers for everything, are they going to lose their critical thinking and problem solving skills? And I think it's a big concern. I have a niece who's a teacher, a high school teacher, and I was talking to her recently, and she said that for their school, that they no longer allow any English tests to be done on your laptop or submitted electronically. It all has to be handwritten, and that's because of ChatGPT, because people were going in and having the AI write their paper for them, and the teachers can't always figure out if it's real or not. And so there we have it. That's the end of my discussion. Let's bring me back on to the camera here. There we go, and bring up my group. And we're going to go into our Q&A. So again, if you guys have any questions, now's the time to start to put those into the Q&A. I had a couple people do some test questions from Facebook to see whether that worked, and I do see it did. It's a learning curve, but anyway, I'll take it to my panelists. What'd you think? What's your thoughts on AI? Is it a brave new world or a feared world?
There is a lot to unload with AI for sure. Excellent presentation. I thought it was very relevant. It covered some of the pros, it covered some of the cons, and it was very entertaining. I was actually listening to a podcast this morning about ChatGPT and its use in healthcare and the ethics around it in preparation for your presentation today. And there was a physician who was, kind of using it out to see if it could help with letters for appeals for insurance coverage or prior authorizations. And he actually found that, even though it gave a great list of references, some of those references were incorrect and the information wasn't right. So I think there's place for it to be very beneficial in healthcare, but we need to be cautious moving forward because this is not perfect system. Maybe it will be someday, but it's definitely not now. Another thought that I had is really around the ethics of technology. There's a lot of benefits, and some people can't afford to have technology. They can't afford to either have a computer, or they don't have access to internet, or can't afford internet. So there's a lot to think about with the health of our nation and moving forward with all of this, but very interesting discussion.
Yeah, I agree that the ethical side is really the worrisome. John, you have any thoughts? Have you used it at all?
Oh yeah,
I figured you did.
Yeah, the vasectomy topic that's coming up in the presentation, I asked ChatGPT to come up with so this is the prompt that I gave it. Create a bullet point list of a vasectomy presentation talking points to nurses by a very experienced urologist. And then it gave me, the more specific your prompt, the better the results will be. And I also kept in mind, okay, the presentation, I want to keep it within a half an hour or so. I want to have, and personally, I don't like to have many words on my presentations. Mm-hmm. So then, based on these prompts, I would create the slides. And so the next step would be to use MidJourney to create the graphics to incorporate into the slides instead of copying and pasting from other sources.
Yeah.
And the better the information, the more detailed the information that you give ChatGPT, the better the results that you will get. Now, a lot of college people, grad students have already, and I think in an MBA program, people have tried to use ChatGPT to compose the documents to see if they can pass these programs. And I think some people already did it and said that they would be able to pass an online MBA program or something like that with a B grade using only ChatGPT. Of course, the educators have already come up with a way to detect AI-generated documents. So if you're going to just have AI create the document and submit it and mail it in, you're going to be found out. But of course, there's something else that you can use. I think it's called Rephrase or Rephraser. I think it's a website where you can take that ChatGPT generated document, put it through Rephraser, and then it'll come out undetectable.
Yeah. My son's in the MBA program right now, and he said that they didn't use it like word for word, but he said it starts everything. He says it gets the ideas going. He says, and they just work off of that.
Yeah.
So really,
and also, I think it's helpful if you want to create post-op instructions, or if you want to create documents that you want to share with your patients. It takes the brain work away from you so that it creates the framework, and then you can edit as you wish. You can even tell ChatGPT to write it in 7th grade language or 6th grade language, which makes it a lot easier. So automation will always be there. I mean, look at the things that we carry with us, right?
Yeah.
I was talking with somebody, and he said, oh, I still have one of these old alphanumeric pagers, I mean, we started with nothing, and then corded phones, and then now pagers within a generation.
Yeah, absolutely.
And now we have computers that we carry with us. Automation will always be there. It is always going to help us progress as humans. The equity, equality, inclusion, that is something that's going to have to be worked out, because technology will always progress. It's up to us to retool ourselves as humans to adapt to the progression of technology. We can't ask technology to adapt to us, because humans are meant to progress and invent and make things easier.
Yeah, absolutely. So we do have some comments coming up. I'm going to bring some of those in. Rebecca said, we had a negative review of our clinic because the patient was upset they had to wear a mask. And it's not something that you had a choice, right? That was mandated by in Illinois. She works in Illinois. Mandated by Illinois that you had to wear a mask, and of course you can get those negative for anything. Let's see here. Neil said,
before you move on, if I could just comment for practices that are struggling with negative online reviews. I'm pretty passionate about this topic. The only counter, because of HIPAA restrictions, we can't disclose any protected health information, including even acknowledging or insinuating that whoever left you the review is an actual patient. So really our only counter is to get a ton of positive reviews. That is really our only counter. You can, and I advocate, I guess I could talk about online reputation management if you want later on, but I advocate for all practices to respond to all positive and negative reviews. And there's a reason for that. But you should respond to them, and the only way to counter these negative reviews is to ask and get positive reviews.
Yeah, you're right. All right, so I have Neil made a comment, I think, to my AI photography or picture, AI fingers, but otherwise has AI fingers, but otherwise good. So yeah, that's true. Some of the artistry does have some flaws to it. It's not perfect, but again, these programs are only going to get better. Neil said, I have heard from providers that AI radiologic interpretation being developed shows a lot of promise. Still needs more development, but is remarkably accurate in some of the more ambiguous cases. Any thoughts?
Yeah, pathology and dermatology have made some advances in that area too.
Yeah.
I think I read something about breast mammograms, that it could pick up things that are being missed by radiologists. Did you say something, Andrea?
Yeah, we were humans and we make mistakes. So if we can use technology for patient safety, I think it's an excellent idea. I know there's algorithms to make sure that we're not missing something serious, such as sepsis. So it can be a great patient safety tool.
Yeah. And Neil's got one more comment for us here. I also read a case of a skin lesion examining AI developing false positives because it learned that the presence of skin rulers in the images was more likely on malignant cases. It began weighing this significantly in its interpretation so that the ruler in the image equals skin cancer. So yeah, I mean, AI, all of it, I think is still at this point in time, a human has to review it. I think it's a good starting point, but you have to review it. I always equate it to like the simplest tool, like the UA machines when they came out, the automated ones that would read the sticks. They're good, but they've got false positives, so you kind of have to correlate what's going on. And a lot of times, microscopic. It may be nitrite positive and leukocyte positive, but you look under the scope and you see no bacteria, maybe just a few white cells floating around. So they can be full, but it doesn't necessarily be, you wouldn't diagnose based on a stick on everything. It's a starting point.
And also you can't just look at a lab in isolation. You have to correlate it with what the patient's feeling. So you don't treat all bacteria in the urine on a culture. Asymptomatic bacteriuria in an elderly female, you usually don't treat that unless they're mitigating circumstances. So you still have to put that interpretive element into the entire clinical picture and not just look at the lab value.
Yeah, I agree. Let's see. I do have another comment that popped up. While I'm getting this next comment up, I will ask everybody has watched as a previous viewer on Zoom and now are watching it on StreamYard to just put a little note in for me which one you preferred, the Zoom or the StreamYard. I don't need if you want to add some extra comments to it, that's great. But if you could just throw a comment up there as to which one you prefer, because down the line, I'm going to be making a decision on whether I continue with Zoom or go to StreamYard. If it seems like it's a good format, then I'll stick with the StreamYard. If not, I'll go back to Zoom. It's whatever's working best for you guys. So feel free to throw that in anytime, so I can just have that for myself. Frank Senese, I know that guy. That's my brother. I'm a fingerprint expert and a hospice nurse. I've seen the tremendous growth and accuracy in fingerprint technology, but we have always relied on a human for final identification in forensic cases. It's not quite AI, but it relies on logic algorithms. So yeah, Frank, that's I watch a lot of those CSI programs, and I'll they say just run it through APHIS or whatever that fingerprint analysis. I think that's it, APHIS, and I always say you're going to be out of a job. All they got to do is run it through APHIS, and that's the end of your job. And he goes, no. He says, you still need a human being to confirm it all. So that goes along. All righty. So I'm still waiting for some folks to give me those comments about Zoom. I do know one thing, that Zoom, Facebook, and Facebook and YouTube and even the StreamYard, there is about a 10-second delay. So I know that sometimes when I ask for something, then I don't always get the answer as quickly as I would think it would show up. Oops, didn't want to necessarily put those up here for you. I wanted to read it.
Actually, I'm watching both the stream on YouTube and Facebook. Facebook is actually, the latency on Facebook is actually less than YouTube currently.
Yeah, I found that when I do my broadcasting from church, Facebook does have less latency. So, well, let's see what we got up here. So Neil Smith said, this isn't bad. It doesn't keep questions up after you answer them, but feels more friendly. How are panelists feeling about it so far?
I wish I could see the names of the people watching, but it's difficult because StreamYard takes outputs to so many different platforms. It's difficult to aggregate all the different users from different platforms and then putting a list up on the screen.
Yeah, the only thing I can see is it does give me a live viewers list, and it says how many people are watching on StreamYard, how many are on EuroNurse, how many are on Facebook, and how many are on YouTube. So I have an idea, but I kind of like that with the Zoom, where you kind of knew who was actually there. But as they ask questions, they are, right?
Yeah, and I also agreed that being able to see the comments that were mentioned before, a running list for the viewer, I think that's a good feature on Zoom.
Yeah. I don't know if I can look in. It might be a way that they could see them. I don't know if I got that turned on or off, but and I don't.
If you have but if you have a huge audience and the questions are going to scroll so fast across it, that'll be challenging too.
Yeah,
that's when you need an assistant.
Oh yeah, you definitely need a moderator or two.
There is a program that you can use for questions that'll let you vote on the people that are looking at the questions, vote on them, and then it goes up to a higher level, so you get the ones that are more pertinent.
Or I think on YouTube you have the ability to highlight the questions that people have paid.
Oh,
they donated money.
Yeah.
Oh.
Yeah.
There's a way. You want your question on the top? Pay. But as far as what my thoughts on the program is, I like the fact that we've got options for how we have our people, our presenters laid out. It's very simple for me to switch them to. And I'm doing this with the mouse and some icons on the screen. So it's a very simple system to use. I really like the fact that I can bring up the questions. It's easier for me to read. I think it's good for the people that are in the audience to at least be able to see the question instead of just trying to hear it. I know for me, I'm more of a visual learner than an auditory learner, so I really like to see the question.
Yeah.
So
From my perspective, it looks more professional and more polished than the Zoom platform.
yeah,
Being able to show the audience comments, it's a nice feature, and also being able to switch scenes where you have the panelists on the screen.
yeah.
That's nice.
So April says StreamYard appears user-friendly. I remember watching at least 5 episodes before learning how to ask a question. Yeah, I think that was a problem that everybody was, having. I mean, that a lot of people have, is that Q&A box didn't always make sense. It's not typical. I think we're used to social media. This is more like social media, more like a Facebook or a YouTube. Just click into the comments section. And Neil Smith says, I do like that it puts the questions on the screen when you address them. Let me test a Dr. Zoidberg. Okay.
I love it. That's
I'm gonna admit my age. I don't know what Dr. Zoidberg
Oh no,
is.
if you look at what he posted, it's like the eyes and then the mustache and then the 2 V's are.
I gotcha. All right, Neil. You caught me. I'm showing off my age.
Hey, if I could just go back to what Andrea said about Epic and automating Epic. I don't use Epic, but I use an EHR every day in my office since 2006. It's the same EHR, just did an upgrade. I tell you, you have to, if you buy a Ferrari, you take that to the track and take some lessons from a professional driver. You take it out on a track and you take lessons to maximally utilize your Ferrari. Same thing with your EHR. You have to spend the time to utilize all the features. I was tweaking around after the recent update about one of the features, which is a visit template. When I see a new vasectomy patient, the questions asked are the same over and over again. And then the assessment plan, I can pre-populate those. And then you would document by exception. The physical examination is going to be relatively the same. You can then go in there and document by exception. Now, of course, you need to know what's actually included in that visit template. But I was tweaking the visit template yesterday. This allows the new patient to come in, the medical assistant to just click on the visit template, automatically populates everything, and I go in there and then document by exception. It makes my life a lot easier. You said, Andrea, you cut down a minute per patient. That's huge. That's a lot. When I'm seeing, so I think I saw 36 patients yesterday. That's a half an hour of time that I could be doing something else, like coming up with ideas for a presentation or working on my vasectomy presentation on March 25th on Euronurse. That's time that you can get back. So taking the time to learn about the efficiencies in your EHR is key. Now, here's something else that I do. Once I do a vasectomy procedure, instead of clicking every little box, the date of the procedure, the preoperative diagnosis, post-op diagnosis, procedures performed, surgeon, complications, anesthetics used, the description of procedure, I use a different piece of software, Dragon, voice recognition, create a macro. So all I do is, while I'm on that screen, I verbalize sig vas nitrous, sig vag nitrous. I say those 3 words. And it automatically does all the clicking for me. Within 5 seconds, the documentation is done. And I just have to go in there to change anything that is not the template, the typical template that I created for that particular procedure. I tailor it to the specific patient. So a lot of different ways that you can automate, just use technologies to make your life easier, because so much of what we do is repetitive. And there are ways to automate that so you decrease the risk of burnout.
Yeah, I agree. And I did that little bit of automation in that one talk a while back on technology, where I showed how I was able to create these things right in the iPad, their text replacement thing, where you just type a couple of letters in and it spits out the whole name. So you can spit out a whole paragraph. But macros are something that I'm not sure a lot of people are familiar with, and it might be worthy of a talk just to kind of show how some of that automation works. I do macros for this stuff here, where I just hit one button and it takes my switcher and does a whole bunch of things that I'd have to take 10 minutes to set up in one push. So it is great. Hey, I got a great answer here from my youngest brother. This is the youngest child in our family, so he's quite a bit younger than I am. It's a doctor in Futurama. So there's a. And now my next question is, what's Futurama? No, I actually do know what program that is. Hey, folks, if you're still out there, don't hesitate to let me know how you like this, because I do need to make a decision for Zoom versus StreamYard. Rebecca said, something tells me some is looking forward to vasectomy talk. I'm sure there are some looking forward to vasectomy talks.
And bring your questions. Bring your questions. That's what I live. I love questions.
Absolutely. That's part of our beauty of this show is you've got 3 experts here that are willing to take and answer questions for you. So take that advantage, because, that's not something you get everywhere. A lot of times maybe in your workplace you can ask people, but you're getting the same group of people all the time at your workplace, where you've got outside experts coming in, all the time. We're bringing in experts. Going forward, I've been, this past week, I spent a lot of time communicating with different folks to talk on the show and line up new talent. And there's a lot of interesting things out there. We had mentioned something about the Iriceps irrigation solution, and I've talked to they have a nurse speaker who's going to come on and talk about some of those usages. I just talked to those that are part of Sunano, Kathy Marchese, who's in the nursing certification, big into it. And I finally twisted her arm to get on the show, and she's going to do a talk on what's involved in getting certified, how to go about getting certified, why you should get certified. She's a great speaker. So we've got her lined up. I've got a couple other calls pending that are new products to bring forth. I think that's really what I like to be able to do for the community, is that time you don't have at work, spend an hour here with us and learn more things about it, from the experts, the people that are actually producing it.
And also you sometimes get institutional bias. You are in your silo and you hear everyone saying the same thing, same way, but then getting a fresh set of eyes and ears and fresh perspective is sometimes illuminating, so that you're not perpetuating the dogma that is so pervasive in medicine, the status quo bias. We've always done it this way, and that's the way we're going to continue doing it. So,
yeah. I'm sure you found that, Andrea, too, and you're working prior to becoming a nurse practitioner, when you're working with a group of doctors. Everybody's got their own way of doing things. Everybody went to a different college and learned something different, and it doesn't necessarily make one better or one worse, but the one thing that it's just being able to kind of put all that together sometimes and get a bigger picture.
Yeah. And having a broader perspective on patient care is really helpful. I think it's an interesting phenomena that different regions in the United States practice differently. And I think that we could really learn a lot from each other. And this is the perfect platform to do it, because it's national, it's international, and it's just a great place where we can share ideas and how to take care of patients better, because that's the ultimate goal.
And it's a safe space. It's a safe space.
I did see another thing come up here. Neil Smith says, clicks per minute is becoming a performance metric in many fields. It was interesting to hear in terms of healthcare efficiency.
Yeah. I didn't believe it at first. I really didn't, but it's been amazing. And then I also use Dragon, and that's been really helpful. I really wish that I would have paid attention to that typing class that I took as a child, because I didn't think I would need it. I can type pretty quick. I do not do it correctly, and I have a lot of errors. And so Dragon's been really helpful. I can speak much faster than I can type, and the technology is so wonderful that it really picks up what I'm saying, even if I mispronounce some medical terms. It's my understanding, and Vic, you may know a little bit more about this, but I think, is there a Google version of a Dragon that's free, where people could use that in their practice if their organization hasn't purchased Dragon?
I'm not sure about Google, but I know that built into like an iPad or Apple device, it has dictation, and I mean, and it's amazingly accurate. And Apple has a chip that strictly does what's called machine learning. So, and I only believe it because I've corrected things that it's spelled wrong and the next time I dictate it, it's right. So it does learn from the errors. So it's and I used Dragon in the past, and it's the same thing. You still got to train it. So it's very accurate.
Well, no, Dragon, you don't have to do much, if any, training anymore.
I haven't used it in a long time.
It is amazingly accurate. Amazingly accurate.
That's if you get the medical package, though, right?
Oh, of course, yeah. You have to get the medical edition because no way Dragon will understand when I say polychronotropic unless you have the medical package. Yeah. If you have to, just buy subscribe to the medical package, because it'll drive you nuts, and you'll say, "Oh, this thing sucks," if you're using Dragon without medical package.
Right. Yeah, and that's the one I used, was not the medical package, but I've seen the medical package because we have it at our office, and I agree, it's a game changer. So I see one more comment coming up here. I've heard from Neil Smith. I've heard from providers that the Apple devices have excellent dictation software. So yeah, Neil, you're kind of supporting my assumption on that too.
Yeah.
Yep, and it's also on Windows and also on your Android phone.
It's also on, I think, on your Apple Watch, because my husband once went to an orthopedic office and they explained ahead of time, we're going to be speaking into our Apple Watches, and it's documenting. So they would speak the physical assessment out loud, and it was going right into his chart.
Yep. That's crazy. What a great world, right?
I remember I used to have to use an electronic dictaphone in the patient's room when I first started. I would turn it on, record, and then that file at the end of the day would get sent to a transcriptionist, who then types that out, and then we import it into the EHR.
Yeah. So it's all good. I think it makes, the more efficient we are, the more time we have to spend with patients, and that's really what matters. Well, it's been a great show. I think we're getting towards the end here, so I'm going to do the wrap up. Next week, helps if I get my picture. Next week, we're going to have Dr. Owejifor speaking on robotic cystectomy. And yes, I did make that picture in MidJourney.
Love it.
We do have the after party available. If you didn't get enough, go over to the website, euronurse.com. Click the after party. After party will bring you into a Zoom room as before. Instead of going to StreamYard for it, I decided I'd just go right to Zoom again and see where it's at. But if you want to chit chat more, go ahead and hit the after party. We'll talk to you there. Otherwise, I would like to thank all my great panelists again. Couldn't do this without you. I'm glad everybody put up with some of the changes here. I think it's good to try new things, and hopefully this will be the way going forward. I so far I'm liking a lot about it. I'll get to look in the way the things recorded on different programs and make some decisions. But hey, see everybody next week.
Thanks, Vic.